Good afternoon and welcome to Thoughtful Thursday, where we continue to highlight positive and inspiring developments from across primary care in the United Kingdom. Today's episode focuses on an initiative that is improving patient confidence, strengthening teamwork, and enhancing the overall experience within general practice: the growing use of dedicated patient support coordinators within GP surgeries and primary care networks. Across many practices, patient support coordinators are becoming an increasingly valuable and recognizable part of the primary care workforce. These individuals act as a consistent and supportive point of contact for patients who may require additional assistance navigating healthcare services, understanding care plans, or managing ongoing medical needs. Their role is centered around communication, reassurance, continuity, and practical support, helping patients feel guided throughout what can sometimes be a complex healthcare journey. The impact of this approach has been extremely positive. Patients often report feeling more connected to their practice and more confident in understanding what happens next after appointments, referrals, investigations, or treatment changes. For many individuals, particularly those managing long-term conditions or awaiting secondary care input, uncertainty can create significant stress and frustration. Having a dedicated person who can provide updates, explain processes, and offer reassurance helps reduce that uncertainty and creates a far more supportive experience. Patient support coordinators also help reduce barriers that can sometimes make healthcare feel overwhelming. Whether assisting with appointment arrangements, helping patients understand referral pathways, signposting to local well-being services, or following up on outstanding actions, they provide practical support that enables patients to engage more confidently with their care. Many patients have described this approach as more personal, more accessible, and much less stressful than trying to navigate systems alone. The benefits are particularly noticeable for vulnerable patients, older adults, and individuals with more complex health or social needs. Patients who may previously have struggled with communication, organization, or confidence often feel more reassured knowing there is someone familiar within the practice who understands their circumstances and can help guide them appropriately. This continuity helps build trust and creates stronger relationships between patients and their healthcare providers. Practice teams have also experienced significant operational and clinical benefits. Clinicians report improved continuity and smoother communication as patient support coordinators help ensure that important information is shared clearly and followed up consistently. This allows clinicians to focus more effectively on clinical care, knowing that patients are receiving structured support outside of consultations as well. Administrative teams benefit from reduced duplication of work and clearer coordination of patient journeys. Rather than multiple staff members handling fragmented pieces of communication, patient support coordinators provide a more centralized and organized approach. This contributes to smoother workflows, fewer misunderstandings, and a more efficient use of time across the practice. Another important advantage of this role is the contribution it makes to multidisciplinary working within primary care. Patient support coordinators often act as a link between clinicians, administrative staff, pharmacists, community teams, and external healthcare providers. By helping information move more effectively between services, they support joined-up care and reduce the risk of patients feeling lost between different parts of the healthcare system. This role also reflects a wider cultural shift within primary care towards more personalized and relationship-based support. Increasingly, practices are recognizing that high-quality healthcare is not only about clinical expertise, but also about communication, continuity, and helping patients feel informed and supported throughout their experience. Patient support coordinators play an important role in delivering this more compassionate and patient-centered approach. Importantly, this initiative demonstrates how non-clinical roles can have a profoundly positive impact on patient experience and operational efficiency. By investing in communication and coordination, practices are creating systems that feel more approachable, more organized and more responsive to individual need. At General Practice Solutions, we are proud to support practices by strengthening the operational and administrative structures that enable patient-focused roles like these to thrive. Through efficient workflows, communication systems and workforce support, we help create the foundations for accessible, compassionate, and well-coordinated care. Thank you for joining us for this week's Thoughtful Thursday. We look forward to sharing another positive story from primary care with you next week.